All right, thank you, Elizabeth. Okay, so we just heard from Elizabeth what the health concerns are. So how do they handle those concerns? Well, Dr. Kimberly Manning is Assistant Professor of Medicine at Emory University Medical School here in Atlanta. And thank you so much for coming in, because we do want to talk about this, medical concerns. One of the biggest concerns, I think, would be water and what might be in it while these people are trying to survive.
Well, when the water has been interrupted like this, then you're really at risk for waterborne illnesses and different types of bacteria getting into the water because it's stagnant. And really the issue becomes things like cholera, like what we saw in Haiti, hepatitis A, and many different other types of infections that you can really see in the water. Also, when water is stagnant, it really starts to draw in insects. So an issue also becomes mosquito-borne illnesses, Japanese encephalitis, which is something that really could be an issue in Asia.
And how do they treat, we saw so much of this in Haiti and in Indonesia, but people losing their limbs in Haiti, as they make these rescue efforts in the field, probably trapped in some water, what are the first things that they should look for on people who might be severely injured?
Well, what you really want to make sure is something that we call the ABCs, airway, breathing, and circulation. And with regard to limbs, you really want to make sure that the circulation is appropriate. With crush injuries and with these fractures, because there's often limited access to care, the reason you see so many amputations is because infection starts to set in because time has gone by. Immediately, you need to really try to make sure that there's appropriate circulation. You need to stabilize the lesion or stabilize the wound and get the person somewhere where they can get surgical intervention without delay.
And are you at all concerned, or would you be at all concerned about hypothermia? Because we see our correspondents there in the region, and they're wearing coats. It's cold. There's a wind chill factor there.
Yeah, and hypothermia is something that certainly is a major issue in this situation, particularly with people who could be immersed in water for long periods of time. So, that becomes a really tough thing, and finding things that aren't wet that can bring people's body temperature up, that's going to be a big challenge here.
And how critical are the minutes, days, weeks ahead in terms of finding people? How long can they survive in conditions like these?
Well, I think what we've learned from recent incidents is that the human spirit and the human body can really do much more than what we've ever thought before. And there were some people during the Haiti incident who survived much longer than we suspected. But this is a slightly different situation because there's also water involved. And I really just think time will have to tell exactly how long people can live. But in general, if someone is underneath water for an extended period of time, it really is a very difficult thing to survive.
Yeah, it's a very, very critical hours ahead, I'm sure. Dr. Kimberly Manning, really appreciate you coming in and chatting with us.
Thank you.
All right. Andrew?